Hi everyone, my name is Tiffany Teubert. I'm going to be talking about my capstone project today, which was titled Building Bridges, Development of an Interdisciplinary Fall Prevention Center. So the focus of my capstone was program development. I was placed at the Department of Health Sciences and Human Performance at Cleveland State University, and I had the opportunity to collaborate with the Departments of Physical Therapy and Occupational Therapy on my project. Ultimately, my project was to develop a framework for an interdisciplinary fall prevention center, and then pilot everything I developed to assess the feasibility of it all. So for some background, falls are a growing public health concern in the United States. They are the leading cause of injury among older adults. And then for adults with disabilities, they report even higher fall rates and related injuries compared to older adults. So overall, there's an enhanced need to expand evidence-based fall prevention services for community dwellers at risk. And given my site, we had the unique opportunity to address that need by developing an innovative, student-driven interdisciplinary fall prevention center that was intended to expand evidence-based fall prevention services, ultimately to promote their health, safety, and participation in meaningful occupations. So for my deliverable, I developed the framework for the center. So this included our mission, vision, our location, description of our services, referral system and eligibility requirements, organizational structure for the disciplines involved, including roles and responsibilities, operational procedures for scheduling, fee for service, funding and equipment needs. I was also able to create a fall risk screening tool and assessment tool. And then I created an outline of fall prevention recommendations and areas for future development for future students and implementation needs. So the fall risk pre-screening form that I developed ended up becoming our self-referral form that was used to identify participants that were at risk for falls. The health history form was the fall risk screening tool that I developed. And so that was a comprehensive screening of personal information, medical history, home living information, and then specific fall risk factors. And so the results of that screening was then used to ultimately determine what areas needed to be assessed in the fall risk assessment. And so the multifactorial fall risk assessment that I developed, that included 38 total possible outcome measures, and it was a two-part process. So the first part included questionnaires that were completed at home, and then the second part included functional tests and assessments that were completed on site. And then finally, I developed the structure for the interdisciplinary team meetings. So following the assessment, the team met to review the results and then ultimately determine the recommendation plan. And then in using everything that I developed, we had the opportunity to pilot test it on 3 community dwelling participants who were of varying fall risk levels. So ultimately, the findings from the pilot did support the feasibility of the proposed center in comprehensively assessing fall risk and identifying modifiable fall risk factors that could then be addressed through a fall prevention recommendation plan that was created by students. The participants and the faculty involved all had positive feedback about the proposed center and identified value in the potential impacts of the center on the community, the university, and student learning. So overall, there are a lot of long-term goals and impacts of this proposed center, and ultimately it is to expand evidence-based fall prevention services, support community health and promotion, advance community-engaged learning opportunities for students, foster interprofessional education and collaboration among occupational health sciences and human performance and physical therapy, promote community engagement, innovation, and partnerships, and ultimately highlight the distinct value and role of OT in fall prevention and working in an interdisciplinary team.